mental health gets affected along with the substance use. And we will discuss about the education and training of the health professionals who are dealing with these kind of situations, and what can be the possible future directions on this topic. So you can see a person sitting in this corner who is very much bothered in his life because he might be an addict to a substance use. So I have included a lot of infographics in all my slides. I hope it will make things interesting and be better retaining in your memory. So have a look at this infographic. Here you can see the substance abuse. In a while, I will also discuss what will be the difference in abuse and use and the later part of this conversation. So you can see what this substance abuse can lead to. It can lead to addiction. That is very well understandable. It can lead to sadness. Dangerous crimes can be performed by the person who is using these substances in excess. There can be a lot of anxiety, depression, and dependence upon these. The needle is mentioned, that means there can be IV injectables in the form when the substances are being abused, and those needles repeatedly using can lead to infections in the skin and the other parts of the body. And the person definitely wants to stop this. How he can do it? By counseling and support. Proper counseling and support is essential. And on this today is 31st May, and today is World No Tobacco Day. Okay, so I feel lucky and privileged that on 31st May I am taking this session with all of you to discuss the important effects of tobacco as well as other substances on your health. So before we dive in, as today is the World No Tobacco Day, so let us understand what is the significance of this day today. So it is a thing which actually raises global awareness about the health risks associated with the tobacco use. Yes, we do talk about this tobacco usage, no smoking, no tobacco every day, one or the other day, but this is one day dedicated to raising the raising the awareness for this topic at a global scale. Then we can also understand the effective tobacco control policies and promote tobacco cessation, provide support for quitting tobacco. It also helps to empower individuals to make informed decisions about their health. That is again very important. And this day also highlights the importance of creating smoke-free environment. Yes, my dear friends, do you know this is very, very important? You might be having in a situation when you don't smoke, but you are in a place where the people around you are smoking. So that can itself lead to passive smoking in your case, and repeatedly prolonged durations of exposure to such smoking environments can indirectly harm your health again. So maybe you have not smoked a cigarette in your entire life, but you are having problems related to the smoke, the tobacco. So that can be also a thing which you need to understand. So what we will be discussing, we will be talking about the impact of substance use. We will be discussing about the alcohol, the tobacco, and the prescription medications. Yes, the basic prescription medications which are used by the normal problems which you are facing, like symptomatic relief, those are also abused in a very large excess. I will discuss that eventually. And then we will discuss about the strategies for support and cessation, about how you can stop the usage of this. See, I know this may be sounding to you something which is already known to you, but try to understand the main thing is willpower. And how will that willpower be instilled inside you? Since long years of chronic exposure to such substances, you need to first understand how will it actually affect your health. And once you have understood this, definitely your inner self will say you to avoid these things. So let us begin with understanding the importance of addressing the substance use, and then we will discuss about how we can reduce the stigma. Have a look at this image. So this single image is actually on a table giving you all the list of the substances which are used. So you can see the prescription medicines here, the injectables, the IV drug abusers maybe. there can be any kind of substances which are injected through the IV route. So another thing can be the smoking, the cigarettes itself, the alcohol, and the different kind of illegal substances, which I will just give you a brief in a later while. So these all things need to be understand, like how these are affecting your health. So before we proceed further, you should understand that we can broadly classify the substances into two categories. One is the legal and one is illegal substances. So as you all know, in India, the usage of alcohol and tobacco is done on a very large scale, and it is legalized to purchase it from the stores. You can easily get these two products anywhere in India. So these will harm your health. So let us understand few things with the help of certain statistical values. So as you all know, India is world number 2 tobacco consumer as well as producer. Yes, it if you remember, in the box of the cigarettes, it's genuinely and obviously in all boxes it is mentioned that the tobacco smoking or smoking a cigarette can lead to cancer, maybe lung cancer, oral cancer. Even the images are drawn, the patient images are drawn showing the cancerous lesions, but still the person is consuming them. So that is the point which I will focus in a while again. And nowadays, as you know, the statistics initially started with men being more affected by these things, but nowadays women and men both are actually equally affected. So the gender predisposition is not in one's favor. And 1 million or more than that are tobacco related deaths only. Okay, so 1 in 3 tobacco users, they die prematurely. Suppose if your health was deteriorating normally due to some other disorder, or maybe your health is affected. So if you are abusing tobacco, the age at which you will die, that may reduce significantly by a decade. Suppose if your lifespan was till 60 years of age, you will reduce it to maybe 45 or 50 by just smoking a cigarette every day. Tobacco related cancer deaths in India are again very high, and the 5-year survival rate of patients with oral cancer is about 50%. So now you know that your mouth and all those things can also get affected. We will show you in the infographic, and somehow you are actually harming your health in a very bad manner, and you can cause. So cigarette smoking is the most common, but all forms of tobacco are linked with increased risk of oral cancer. So that is very much important to understand. Another statistic for you to understand, that teen alcohol consumption nowadays, that is also a big problem. The kids actually, they are starting to drink alcohol from right from the 9th grade, or even the 12th grade person, he is affected by his peers. So that needs to be taken care of from right from the school only. So family support in this and friends, so these things are very important for to avoid this thing from happening. What actually leads to the youth drug abuse? So the desire for new experiences, that is very important. A person is influenced by the other person who is already consuming these products on a daily scale, and he addresses that how like you can feel better in your life. Maybe someone is depressed, so these things can be actually influencing the person to start using these substances, and that can be a trap. Then lack of positive peer and parental support, that is again important. Sometimes family is not taking care of these teens, adolescents. So right from the adolescent age, you should be able to have a good parental support, and if not, the families, even they can have approach to the friends. Then the genetic predisposition can also be there. The availability of substances is another big issue, and lack of supervision, adult supervision, that is again important. So anywhere if you see a teenager and who is your family, so you should be very much active in identifying the problems. So common signs of addiction in teens. So suppose if you notice these things right from a very beginning, so you can notice mood swings, you can appreciate depression, euphoria, experiencing extreme elated, the person is super happy at socially unacceptable times. So that is also a problem. And depression can be due to other causes also, but if it is present in the absence of any other problems, then definitely that can be one of the signs the person has been becoming an addict to a substance. The person can resort to a criminal behavior. That is again a very important thing. So if not undertaken, if supervision is not done, then there can be tremendous consequences for the substance use. Then sleeplessness. Nowadays it is very common due to the hectic schedule of any person. The people are not able to sleep properly. So even the substances, including the the certain drugs which can be helping to aid the person to sleep. So if that drug is abused in a wrong manner, so once he stops using that agent, definitely after a while he will not be able to sleep properly. So the body will have dependency on that stimulant to sleep. So that is again something to be pointed out. Then unexplained absences from work or maybe school, college, and then different kind of anxiety issues can be present without any obvious other problems. Then addiction cravings can exist. Again, mood swings can also happen. Then the person can show a change in appearance. So the certain drugs can have a depleting effect on the person, like someone's body weight might either increase or decrease in a very short span. Or the person if says that he is forming new social groups, so that is also something to be supervised. So what persons he so what he is talking to people with friends, that is also something to be taken care of. So what are the health consequences of alcohol use? So let us understand them. See, one thing is understandable, there are certain short term effects and there are certain long term effects. Okay. So what can be the short term effects? So if you have an understanding about these health consequences, remember your mind will subconsciously put you away from taking these things. One is poor decisions. So definitely using the alcohol can affect your behavior as well as emotions. There can be coordination problems, your reaction time can get slower, and that is the most common problem people face. So if you have done alcohol intoxication, maybe do a party or something, so you should not drive that day because your reaction time may slow down. So accidentally you may hit another vehicle in front of you when you wanted to brake, but your body is not able to respond very quickly. Then your body can have struggle while articulating the speech. So your brain can't form the words as fast as normal. So that is again another issue. Then there can be digestive issues. I hope this all things are very commonly seen. You might have seen this in your life sometime, or maybe even the movies are showing these things. A person has taken a lot of alcohol and he is vomiting in the party. So that is understandable that digestive issues can happen, and not only vomiting, diarrhea can also be present if the patient has already taken a lot of alcohol. And a bad night's sleep affects the quality of sleep, so you are always tired. So that is also another problem. Then there can be a need to pee all the time. So the person may feel an urge to pass urine at all the times. Frequency can increase, and please remember this needing to pee can be misdiagnosed. Okay, this can be misdiagnosed with other problems. So person the diabetes, type 2 diabetes mellitus also has its initial symptoms where the person presents with the increased frequency to pass urine. So that also needs to be understand that the alcohol abuse can lead to these short term effects. Then long term effects. So using the alcohol over a long span, maybe years or so, can lead to excessive weight gain, as alcohol contains a lot of empty calories similar to the junk food. So if you keep on consuming a lot of junk food, your body is actually gaining empty calories, that is zero calories. So you are only gaining weight using these products. There can be skin problems. It can lead you with the dry skin issues, or triggers the problems like acne and all those things, then depression can happen. The heart problems can be linked to the alcohol abuse. The high blood pressure, heart disease, and even stroke can happen. There can be cirrhosis of liver, that is heavy scarring of the liver tissue, which can lead to a life-threatening concern for the patient. And lastly, the cancer is also linked to alcohol abuse. So there are a lot of cancers which are directly linked to the use of alcohol. So have another look at a different infographic showing the different symptoms and effects of alcoholism. So definitely it affects the brain. So in a 5-second look before I dive in, you can understand most of your major systems of the body are getting affected by alcoholism. So esophageal varices is something very important. So what happens when you are drinking too much alcohol? So you tend to actually erode the mucosa inside the esophagus. So I hope you take the food through your mouth and then it goes to the food pipe, okay, that is the esophagus, and then it goes into the stomach in the abdominal region. So what happens when your alcohol is actually passing through esophagus? It can lead to the erosion of the lining, and it can lead to bleeding, or that is known as esophageal variceal bleed. And similarly, it can lead to stomach ulcerations. Okay, in the stomach, when the alcohol goes, it can lead to chronic gastritis, vomiting issues, and stomach ulcers. Again, those can also bleed in a later phase. So that is one thing which you are directly putting your body into, the insulting the body mechanism. Then another thing, the lungs can be affected, breathing difficulties can happen, liver, as I told you, can be swollen or even go cirrhotic. So then there can be heart related problems, increasing irregular heart rate, strokes, and even high blood pressure can be one of the starting things with the alcoholism. There can be muscle weakness, muscle wastings, pancreatitis can set in. So there is an organ inside our body, that is pancreas, and again it is linked to the metabolism of the glucose. So insulin and glucose, those are something which are balanced by the pancreas. So if pancreas is not functioning properly, it can again be a cause of the diabetes. So you are actually predisposing yourself to a lot of acute as well as chronic health conditions. So have a look. So heart disease, liver disease, brain related problems, amnesia. See, one of the other infographic is actually adding some or the other in the discussion. So here one thing is added, that is the sexual problems. So men can have erectile dysfunction. The females can actually have fertility problems. They can have difficulty to conceive if they have started with alcohol, and so many years have passed since they are regularly using the alcohol in an excessive quantity, and finally it can lead to death. So other effects can be, I told you, accidents can happen due to the decreased response time. There can be a police arrest. Yes, the person can go into playing part into certain crimes accidentally. He's intoxicated, and that can also lead to the police arrest. Another thing, he can go into a unwanted quarrel with any person, which could have been easily avoided if he would not have taken alcohol in such quantity. Then lastly is homelessness. That is a very severe big problem in India. See, just imagine, picture a person in your mind who is belonging to a rural area, and he is spending all his hard earned money, even his family income, on buying alcohol, and he is affecting his health. His totally severely, you can say, intoxicated on a daily basis with alcohol. He returns to home, his family is in a mess, and they don't get proper food to eat, and ultimately what will happen, the family will begin to not accept that person as at home, so he will be rendered homeless, and that will actually destroy his life as well as his family. So that can be a big concern with the long effects of alcoholism. Then what are the health consequences of tobacco use? So the one thing we discussed was the alcohol. Now we are discussing about the tobacco usage. Then you can see there can be a disease known as COPD, that is chronic obstructive pulmonary disease. And there can be a toxic chemical exposure due to the tobacco use only. and it can again lead to a lot of problems in the body. There can be nicotine addiction in the person who is consuming the cigarettes, the pipes and everything. Then there can be stroke. Yes, brain, you can see this brain is shown in this image and a black spot is shown. So a part of the brain, a functional cortical area of the brain, can be predisposed to having a less blood supply, and that can lead to indirectly the lack of function from that area. So suppose if the movement of my hand was represented by that part of the brain which is affected due to the usage, and it is the blood supply to that area on the brain is cut, so definitely that person will have the paralysis. So it may be a hemiparalysis or quadriplegia. There can be any kind of problems where one limb stops working or both the sides stop working. So there can be stroke like condition. These are known as cerebrovascular accidents. Okay, so there can be a transient ischemic attacks in the initial phase, which can lead to a lot of problems. Then similarly there can be heart disease. So you can see this specimen showing the heart diagram, and there is a black spot shown here. Again, a part of the heart which is supplied by the coronary arteries can be having a cutting of blood supply to that part, and that area of the heart muscle can be deprived of the blood supply, and hence there can be ischemic changes, and it can lead to angina and all the pain, and also the infarction in that area that you might have heard of, myocardial infarction, MI. So there can be heart disease, or even the simple basic things like high blood pressure can be associated with these things. And finally there can be a cancer which can be related to the tobacco use. Cancer can be anywhere where the toxic chemicals are going, so that can be even the lung cancer, the oral cancer, so anything related to that. Have a look how smoking harms the body. You can see again it is affecting almost all the parts of the body and in a very negative manner. Heart, it doubles the risk of having a heart attack. Lungs, as I already told you, lung cancer and COPD. Circulation can be affected, increased blood pressure and heart rate can happen. Fertility in men can also be affected. There can be impotency, erectile dysfunction in the person. The bones can become brittle, and in women the osteoporosis risk increases significantly. The brain, the chances of having stroke in the brain is increasing. So suppose if the person is already having certain chronic conditions, and on top of that he starts smoking and he becomes an addict, so that can be a problem. Then mouth and throat. So just have a look, I am zooming in. So it increases the risk of cancer in the lips, tongue, throat, the voice box, that's the larynx, and the esophagus. So you can understand all the systems of the body, once the alcohol starts going or the smoke starts entering into your body, the tobacco, the pathway from wherever it enters or affects the surrounding areas, it's actually going to cause the problems everywhere. The stomach, it increases the chance of getting stomach cancer or ulcers. Ulcers we have already discussed. Stomach cancer can also happen, gastric carcinomas. Then the fertility in women can be affected. I told you it can make harder to conceive, even the alcohol does that. Similarly the skin, now skin can be lead to dry skin, or a very big problem, that is premature aging of the skin can happen. So that can happen even by a decade. So 10 to 20 years you are actually prematurely aging your skin. Then now number 3 category. So this is number 3 in the list. First was the alcohol, second was the tobacco. Now third is, we are understanding the substance, that is the prescription based OTCs. OTCs are over the counter available substances. So what are these? I think you all have used them in your life. The painkillers, the sedatives, the antibiotics. So you understand that each of these agents, each of these issues can be actually abused by the person. Suppose if you go to a doctor today and you have been prescribed an antibiotic X, okay, so you get same kind of illness, according to you, you feel the symptoms are almost same, and you start taking that same antibiotic again without the doctor's consultation. And suppose this cycle repeats on again and again, and ultimately you don't understand that your symptoms may be different the next time, and it may even not require the use of antibiotics, or if it requires, maybe there is another alternative antibiotic which is better available for the problem which you are facing. So definitely you should consult your doctor rather than using the sedatives, antibiotics, painkillers and other stuff automatically by yourself. Even the antacids. So all these are commonly misused medications. The people are becoming self-aware and they are using the Google for the problem, and hence they are actually abusing this drug on a very large scale. So this is something which you should stop doing, as it can lead to addiction, even the overdose. I get a lot of consultations where I get to hear that the patient has taken an antibiotic in a dosage which was not prescribed by the doctor. They just took a dosage as fetched from the Google, and maybe they have not read it properly and they have taken it in the higher dosage as not recommended by the person's body weight. So that can be a problem. Ultimately it can lead to organ damage, and this can also lead to a mental health impacts like cognitive impairment. The person can have a thought block and the person is not able to think properly, and anxiety issues can happen, even the depression can happen. The person's ability to think can be affected if the OTCs are misused. So you can see the OTC overdosage, what are the common signs and symptoms. So it can again affect a lot of organs in the body. It can have a lot of effects on the brain like headache, confusion, drowsiness, etc. And the skin related problems like the skin rashes, hypothermia, redness can happen. The abdominal pain can happen. The liver failure and kidney failure are the main problems which can happen with the use and abuse of OTCs. Then there can be GI disturbances related to the usage of OTC like the nausea, vomiting, diarrhea. There can be muscle rigidity. Cardiovascular disturbances in the form of increased heart rate, variation in the blood pressure, even high or even low, that can happen. Lung edema can happen, which includes the cough, shortness of breath, wheezing, and increased breathing rate can be seen in those patients. So you need to be aware how you need to avoid these OTCs and never do an overdose of those. Suppose a person is having simple fever, so he should not keep on taking the paracetamol. He knows that paracetamol is working for the fever, but his fever is not going down. So it doesn't make sense that you keep on taking a dolo or a paracetamol again and again repetitively after 2 hours, 3 hours. So that is actually doing an overdosage. It won't be helping you to reduce fever. You will be harming your body in the long run. Then there can be something known as illegal substances. So these are not readily available in the market, and if you fetch these products from somewhere and abuse them, this can be an illegal thing to do and an offense punishable by law. Also, it can lead to tremendous health effects, more profound as compared to the ones which we have discussed till now. So you can see this image is actually showing certain drugs, okay, the cocaine, the heroin, methamphetamines. So you can see a very beautiful image in which a person has written stop with this powder. So you can see you need to stop the usage of illegal substances, whether in small quantity or high quantity does not matter. You need not take them. So what are the effects of these drugs on driving? So the different kind of drugs like marijuana, methamphetamine or the cocaine, the opioids and the different kind of sedatives. So these all are very important to understand because they again help to slow the reaction time. So again it can impair your judgment of time and distance while you are driving. So suppose if there's a vehicle on the highway road which you are driving and you don't judge the distance carefully, you can actually land up into a very big problem and also cause harm to the other people around you. It can lead to aggressive and reckless behavior. You can go into a road rash or a fight with a person which is not required at all. You can simply say sorry and move on. So you should not go into such reckless behaviors. If you are going using these drugs, it will make you affected. And opioids, so drowsiness, impaired memory and thinking skills are the problems which happen by the usage of opioids, and those are not available everywhere. Only if prescribed by the doctor they can be given to the patient in certain kind of medical conditions, including the sedatives. So sedatives are also the drugs which are given to the patients in certain kind of health illnesses related to the psychiatric disturbances, and they should not be abused because this will lead to dizziness and drowsiness in the entire day. So that again is important to understand and avoid the usage of these. So what are the health consequences? The overdose, the infectious disease. So HIV and hepatitis can set in. So do you know that HIV, you might have already heard till now in your life, HIV is not only transmitted through sexual contact, it is more oftenly, transmitted by the needle injury, and those needles can be abused by the drug users. Suppose if someone is injecting these kind of illegal substances in the through the IV route, so those infected needles can actually cause a problem in the normal person who is using them for the first time. So you should avoid this kind of illegal substances. Then it can lead to organ damage, as you already understand. This can lead to severe addiction, psychosis, anxiety, as well as depression. So, so many profound physical and mental health impacts are there. Now, how will you identify the early signs of substance dependence? Suppose if a person is using the substances but he doesn't know. So, what can be there? So, there can be increased tolerance. He can slowly increase the dosage of them and feel no problem. So, that can also be a issue in that person, which can be addressed at the very starting phases. And there can be withdrawal symptoms. The person can have issues during his normal day-to-day activities once he stops using these substances in the initial phases. And there can be neglect of responsibilities. The person who was designated or given a responsibility, maybe a family responsibility, he skips them or ignores them, or you can say when he is confronted he says it's not my responsibility. So there can be psychiatric manifestations of this substance dependence, which can ultimately lead to the neglect of responsibilities. Then there can be psychological indicators like cravings, loss of control, continued use despite harm. So suppose you are using the information available everywhere, you know that it is harmful to your health, but still you are using it continuously every day. So then again, this is important to understand. This can be an early sign of substance dependence. So you see in this image, you can see everything is in the brain. Okay, so you can remember everything which is driving you to take these substances in your brain only. What are the symptoms? So there is an urge to use the drugs regularly. Intense cravings for the drugs happen regularly. There can be a thought block. Large intake of drugs can be happening. The person can be spending all money on drugs. I explained you in the beginning only, that can be a problem for the family as well. The person can ignore the personal obligations, so that can be a problem. So all these issues happen with the person who is abusing these kind of substances. So understanding the stigma. So what is actually a stigma? So this was used in the title. Stigma is a set of negative and often unfair belief that a society or a group of people have about something. So I know talking about these substances is actually a stigma nowadays. It's a taboo and people feel less comfortable to discuss it with their peers, including their family or the friends. Some friends, they are very comfortable to discuss, but definitely with family, some people are not able to discuss these things, especially the minors, they are not able to discuss. So what happens, this stigma actually impacts the individuals to their willingness to seek help. So they refrain from discussing these things with their family, and it can lead to a bigger problem overall. So you can see this infographic, there can be an addiction which can lead to a big problem in their life. There can be a lot of cravings for the things. So there can be depression, intoxication. Depressed person can actually go into this state, that is, he can commit suicides also. So there can be a lot of problems related to the lifestyle. So there are a lot of issues related to these substances. So suppose if a person is pasting this slip to you, help me to stop. So it's your job as a person who is, you may be yourself an addict to a substance, or you may be having to see, happen to see your friend, maybe your close friend or someone in your family, so you need to stop these things. So either you can work upon yourself or help someone to stop these things. You can see on the table everything is kept. There are so many issues which I discussed till now. So let us see how we can do these things. So number one, we need to understand the cycle first. What actually happens in your brain? So I told you in the initial phase I will be discussing about this. We use the term substance abuse, so that is, the person is using them in an excessive quantity which the person should not have used, and then he becomes understandable, okay, this substance is bad for my health, I will not use it to a very bad extent, excessive extent. So he begins to use the substance. Okay, now even the usage of substance leads to a disorder in the body, so then it will be known as substance use disorder, SUD. So what does it mean? It's a persistent use of drugs despite the substantial harm and the adverse consequences to one's own self and others as a result of their usage. So the person knows that the usage, a mere simple usage, not abuse, the usage of that substance is harmful to his health, but still he keeps on using them. So then that becomes a substance use disorder. And what happens in this cycle of addiction? There is initial frustration in the person. He starts fantasizing, obsessing, and he starts abusing the substance. He loses the control, and ultimately when he gains control, he has a guilt over the usage of that substance. He begins to stop the usage, cessation of the use, and with the different passage of time, maybe a week or maybe months or years for some people, it can again lead to the same cycle, internal frustration and everything. So actually, once you know the cycle of addiction, you need to break it at any point. If you know it, you can break it. So provide support for family and friends in the form of emotional support and practical support. So open communication is something which I always recommend to my patients. And empathy is something again you can do as a human being. You can do this with your family and friends once you come to know they are facing the problem. And very importantly, there should be a non-judgmental listening. You should not be judging the person. If someone is taking alcohol since 2 years, so you should not start judging the person. It's a similar thing like you should not judge a person by someone's dressing sense. So you should not have a non-judgmental approach while listening and giving your advice. Then you can help the person with daily tasks, encourage treatment and participating in the support groups. There are a lot of support groups available offline and online, so person can approach them. You can see a very happy group of friends or maybe family standing here, so you can understand how important is this and concept of providing support. What is the role of me, that is a healthcare professional just like me? We again will provide a non-judgmental care and support to the person. So this is an important aspect. We can educate the patients and families to understand the substance use disorder, and we can advocate for policy changes and support systems in that area, how we can approach that person. So a team of doctors can actually be very helpful to the person who is not getting any help from maybe family or friends. So first, I see, I am a doctor, I agree. I am also myself advising everyone, first approach your family and friends, only good friends, not the bad ones who will take you to alcohol. No, the good friends and family. If you are not satisfied or inhibiting to talk to them, then you can come to a healthcare professional. So there are a lot of support systems for alcohol and tobacco users. There is an importance of supportive environment for recovery. So you can see this group of people talking to each other. Okay, so see this bubble, that is the blue bubble. The person is thinking to drink alcohol. The person is thinking to maybe take the prescription medications. The person is again thinking to drink the alcohol. But what is happening? The same person is actually discussing about the ill effects on the health. Maybe heart is drawn with the ECG. The person is knowing that it will cause a heart disease. I should not take it. Another person in the same group is talking about no smoking, it's very bad for health. So this entire discussion can lead to a good healthy problem, a support system, when the person is actually helping each other to understand why you should not take alcohol or do smoking. So treatment for drug addiction involves psychotherapy, medication, behavioral therapy, hospitalization in the extreme cases to detox, and there can be support groups with like peer support resources, and that can help you in the long run. So what is the treatment for all these substance abuses, be it alcohol, tobacco, or the various other substances which we have discussed? Overall, you can say counseling is the main part, then detox and rehabilitation is the main thing. Specific treatments involve medication assisted treatment in case of chronically severe cases, and behavioral therapies if the person is having detrimental effects manifesting in the CNS, that is the central nervous system. So you can see these two images. One person is actually saying no to alcohol, he is giving a no, I will not drink alcohol. The doctor, he is actually breaking the cigarette in front of the patient, so he can help. The role of healthcare professional is again important to quit smoking. So there are 4 supporting foods that can help you when you plan to quit smoking. You can start consuming milk, nuts, fruits rich in vitamin C, and different kind of green leafy vegetables. So then definitely you can actually crush the pack of cigarettes, and you can have a strong determination in your mind also. And Alive Health is actually launching a program, Quit Smoking, so you can enroll in that also if you are having difficulty in quitting the smoking. So some tips to help you to quit smoking. See, you have to take your mind away. Okay, so you need to feed your stomach, your body should feel rejuvenated, hydration should be proper, and your mind should be taken away in the entire day. So what you will do, you can help to clean your home, avoid smoking triggers, keep your hands and mouth busy, and practice deep breathing exercises, and drink a lot of water, maybe 3 liters, 4 liters, or even 5 liters in a day. And you can take up a new hobby, maybe art, dancing, singing, anything, playing guitar. I advise many of my patients to take a new hobby, whatever they have been always trying to pursue apart from your main job. So your hobby is something which you can pick up, and your mind will be getting diverted. You will not tend to smoking. Smoking, alcohol, all these things often tend to happen when the person is quite idle in the life. He is either depressed or idle without any too much work. He can actually think of going to smoking and alcoholism. Do some meditation, a very simple trick. Just sit in your office or maybe your home for 5 minutes. Even if you close your eyes, feel your breathing in and out. You don't need to do deep breathing, simple breath also. If you start feeling it and let your thoughts come in, go away, that's how you can simply do meditation every day. There can be a lot of treatment options for the alcohol, like medical detox, IPDs, the partial hospitalization programs, the intensive OPDs. So there can be a lot of treatment options for the chronic alcoholic patients. Then you need to understand this cycle of relapse. So relapse prevention planning is something which you should understand. Step 1. So the first step is emotional. Your subconscious mind is actually working, but you are not fully aware of it happening, and it can still influence your actions and the decisions you make. Step 2 is the second step is the mental. So mental relapse is the moment you begin to think about going back to that old life. You also start to remember all the good times you had during your addiction, and you choose to forget the bad times that come with it, and that can be a problem for you. The third step is very important, and you need to try to break it. That is the physical step. So physical relapse is the part that no recovering addict wants to do. You have listened to that little voice in your head that tells you just one more time it will be okay. So when you have stopped taking alcohol, mind actually diverts you. Okay, one glass won't lead to any problem, so that will be a issue later on. You will again fall into this trap of taking alcohol every day. So you don't need to listen to that voice that tells you one more is gonna be okay. So that is very, very important to prevent the relapse. So recovery, addiction, you need to recover from the addiction, mental health and substance use disorders. That is very important. So co-occurring disorders like with the substance use and mental health conditions, integrated treatment approaches for a comprehensive care is essential in this aspect. You can see the brain kept aside with the substance use. So this is something very important. Any kind of substance can be affecting the mental health overall. So lastly, the strategies to overcome this stigma, very important, raise awareness. That's what I am doing my part today. Today on this World No Tobacco Day, I am trying to raise awareness amongst you people, and you should also try to raise awareness around your area where you are working. So education and awareness campaigns must be organized, and if there are runnings, you should participate in them actively. Then role of technology in support, that nowadays we are running too high in technology. AI, artificial intelligence has come in, so there are a lot of apps and online resources for monitoring and support. You can see a person shaking hand with the technology. What is happening nowadays, even the simple Apple Watch or smart health watches can actually help you to track your relapses, your smoking habits, alcoholism. So what you can do is, suppose if you plan to stop smoking from today, you can have an app in your health app. You can have an application in your mobile or link to your smartwatch, and it can remind you not to have or that thought again. Or if you even have, you can log that in your watch quickly, and next time you will understand that how much times in the month you have relapsed and what are the trigger factors. You can discuss these things with a healthcare professional in the long run. So this technology can actually help you to avoid the usage of any kind of substances if you have a strong determination. So a need of education and training for the professionals, that is again very important. Importance of ongoing education, available training programs and resources for healthcare professionals are also there. So there the person should try to improve their skill set. So having said that, last slide for today, that is the future directions in substance use support. So we can understand that the approach can be a personalized medicine. So the person can have approach. Suppose someone has diabetes and is having alcoholism since many years, so the set of treatment for that person will be different as compared to the person who has an alcohol only for 1 year maybe, or type 2 diabetes has been detected maybe 1 month ago or sometimes. So there can be a personalized approach. So it's not one size fits all approach, and hence we can also have a holistic approach also. We can have an overall, suppose a person comes in with a problem with alcohol, so we need to check the entire body if there has any effect on the mental health, maybe the physical health, the organs damage. So we need to have a holistic approach to that person. Technological innovations actually are very much needed in this support for substance use, so that can be developed. So research advancements in the substance use treatment is something in the future we look forward to. If the area is getting more attention, there can be more help in the society. So that's all from my side. Thank you all so much for your attention. So some people who have joined late can know I am Dr. Nikhil Aggarwal, and I am available 24/7 for online consultations on Alive Health in the category of general physician, diabetologist, report interpretation, and cough and fever categories. So thank you everyone. So if Siddhi, if you are online, you can please go ahead.
Yes, sure. Thank you so much, Doctor, for such an insightful session. I'm sure you conveniently managed to debunk a lot of misconceptions that people had around substance abuse. And at the same time, your suggestions, I'm very sure that they are going to help so many of users in their quit smoke journey.
Thank you. Thank you. So, Siddhi, I think that's the questions we got.
Yes, that's it, Doctor. Thank you so much. And everyone, please help us improve the experience by providing a valuable feedback post the webinar. And once again, do download the app to access the maximum benefits in case you all haven't. And
Okay.
yes, thank you
Thank
once
you.
again. Thank you, Doctor.
Thank you. Thank you everyone for patiently listening me. Thank you. Thank you.